Yeah.
Ladies and gentlemen, boys and girls, coming to you with, again, I'm Dr. Larry Burchett, ER doctor from the front lines. Once again, Dr. Jane Jenab and her cat, I hope, will make an appearance in
She
our...
does not.
How you doing, Jane?
I'm doing all right. Tired, stressed,
How are you?
not doing okay. Yeah. I mean, I've been living, breathing, sleeping, working COVID-19 for the last several weeks. And I was doing it even before then, but things have ramped up here so quickly that it's just all consuming at this point. I'm trying to find ways to tear myself away and to have some sense of normalcy when I'm home, when I have the chance. But I've got to leave again for work soon, and the peak of the surge is headed our way, and I think there's a lot of unknowns as to how bad it's going to be, and what that means for us and for our friends and for our family and for our work family. So yeah, a lot on my mind.
God, I feel the same way, that all-consuming... I was joking about this. I had this incredible... You'll like this
Oh
story.
no, what?
Yeah. I so I bought this restoration hardware couch on Facebook.
Oh no.
$7,000 couch, Janab,
Larry, what did you get it for?
for $100.
Oh my
Had a
God,
couple
good for you.
scratches,
That's my
needs to get
bargain
looked at.
hunting friend.
And so it was, I love doing that for a long
I
time.
know.
Sitting in the garage for a while, and I'm like running around doing these videos. I just like, all consuming is a good way to describe this, between like actually
Yeah,
working in the environment, being prepared at work, doing the right
yeah,
things, and ordering the test and all that. So, whatever's appropriate, whatever we're doing right now. But then also trying to stay up in the media conversation and contribute something is just
yeah.
exhausting. It is so
It's literally from the
exhausting.
minute I get up to the last thing at sea at night before I go to bed, and I need to stop that
I
because
know, I
it's
know. I can't do it. I got to stop it too. And so this is like my mind
yeah.
walked by and I saw the couch. I'm gonna move that couch into the
Good for
basement
you.
today.
So did
Felt
you?
incredible.
Yeah,
And then I
nice.
watched a couple movies on it, and
Yeah.
great couch. But
Stop
just like
chewing
the
on
whole
camera. What
like,
are you doing? You've got a mouthful when you're trying to talk on
oh,
camera.
I'm
Stop
sorry.
it.
I'm hungry. I'm trying to
It's
keep my nutrition up.
not just you and me. Yeah, I'm a big gardener, and I have created kind of a community garden here in Denver where I put in 24 raised beds last year. I invited all the neighbors last year to help me out and to learn about gardening. And a lot of what we have, we donate. And stop eating bananas on the video. Um,
We gotta have
so
fun too. We can't be
it's
serious all the
I
time. I
agree.
love your garden.
Yes,
Keep talking. I can eat and you can talk.
and and this year, I think it's going to be even more important because there are going to be so many people who are out of work and who don't have a lot of money and who aren't
Hmm.
going to be able to afford healthy food. So
Yeah.
I think the majority of what we grow this year, and we grew thousands of pounds of vegetables last year,
Oh my gosh.
and I think I'm ramping up production this year. So in the time that I'm here, I can't watch you eat a banana and talk, Larry. I'm sorry. Um, and pardon me, yes, I am touching my face, but I just got out of the shower and I've been in social isolation here in my house and haven't seen anyone since I got back from work days ago. So I planted a lot of stuff at my place, and then today I'm going over to the big site and I'll be planting a lot of lettuce and arugula and radishes and peas and all of the good kind of cold weather vegetables. So I anticipate that I'm going to be helping to feed my neighbors and donate to the food banks again this year. And we're going to try to grow even more than we did last year. So,
Good for you.
and boy, my mind just clears when I'm outside and when I'm digging in the dirt and I come back and I feel more like myself, which is really what I need to do because suddenly I've turned into this, you know, I'm not an expert, but everybody who knows me and works with me knows that I've kind of kept up with this. I've, with the media blitz I did about a week
Hmm.
ago
Hmm.
and was all over national news and stuff like that. All of that, I just feel like I have to be up to the minute on all of the numbers and all of what's going on and try to give good information to people who ask. And that includes my friends on Facebook and my family members. And so I feel this additional weight of needing to know everything that's going on because I know people are going to be asking and, trying to help out at my hospital answer questions about protocols and help devise ways to manage the increased volumes that we're going to be getting and that we're already getting. So it's a lot.
It is. There's a couple things that come to my mind as you're talking. Number one is, I've heard a lot too, people that are thankful when we do these interviews and
Oh, good.
as doctors, sure, we're not Fauci, but
No. God bless Dr. Fauci, American hero.
it was a great interview with him and Trevor Noah. It was
I
only
saw it.
13 minutes long. I really
I
liked that.
saw it. Yeah.
Yeah,
It
good
was great.
interview. But it's impressed upon me how, especially, and I've had a conversation with a psychologist about this, adolescent psychologist, Susie Zinn. I've done a couple things with her. Those are going to come out. But with social media and especially the younger generation that gets their news from that as opposed
Yeah.
to
The
traditional
night
media
news.
outlets of newspapers, which are gone and have
Yeah.
turned into the online New York Times, and then CNN, for example. That
Right.
demographic is very different, and reliable, non bullshit sources
Yeah.
in
And even
social media
magazines.
is so
Yeah,
there's
like
more
Time
bullshit than not.
and stuff like that. This is moving so fast that magazines, are a week or two behind by the time they go to press. I mean,
Yeah,
it's literally changing hour by hour. So
yeah.
yeah.
I really want to encourage, I worry about you and I want you to stay safe. I really want to encourage you to get in that garden and to take breaks. I think it's great that you are using your expertise and voice, which you do have great ones of both. We are experts in some of this realm and can do a service to people by sharing what you know. But I want to encourage you to take care of yourself and get out in that garden and me. This is a message to you, and it's a message to me. So it's
I'm going to get out in the garden. That's not a question.
good.
Yeah.
The other thing that maybe we could talk about this for a little bit, and I do want to get into what you saw when you were back at work. I go back to work
Mm-hmm.
on Monday for 4 in a row, and it hasn't quite hit
Yeah.
California yet. Nothing like New York, but
Boy, New York.
I want to talk about that in just a second. But
Yeah.
before that, I've had a lot of people who have asked me, I want to help. What can I do? I
Mm-hmm.
really like how you are thinking about the people around you. You're putting your energy into your own garden and you're making food and you're anticipating that you're going to share that with people and to meet
Yeah.
a very basic need of food in that way. I think that's great. I really like so that I think one answer to the question of what can I do is looking around at your community. What are your
Exactly.
talents? What
Exactly.
can you do? And then what does
Yeah.
your immediate community
Yeah.
need? And that's the beginning of how you answer that question.
Yeah.
People want to rush and, hey, can I give some masks? Hey, can I whatever? I think really the answer, sure, you could.
Mm-hmm.
More than one person has said, I got some masks. Can I drop them off? And I think the answer, especially in the time of crisis for a place like New York and I would anticipate it's going to go elsewhere, is
Yeah.
looking at your community and what can you offer them. So what do you
Yeah.
tell people when they say, I want to help? What can I do?
Well, I think all of that. I think looking around immediately with your neighbors and your neighborhood and your city, seeing what people who is in the most need right now. That's going to be folks who rely on a lot of the services that are now closed and not open to the public anymore. Our older folks who maybe would have gone to a senior center to have some type of companionship and to have a warm meal. Our homeless community is in dire need right now. Um, I think that there are like you said, everybody has a talent. For me, I consider medicine my job, although it's a calling and it's something I've wanted to do since I was 6 years old. But yeah, gardening and bringing people together, I think, are two of my talents, and I take joy in connecting people. I see someone over here who has a need. I see somebody over there who has a way to help, and I put the two of them together. I've just always known a lot of people and been able to connect people in that way. And then through my own physical labor, the seeds out of my own seed stash, and the sweat equity of working in a garden, I can watch things grow and I can actually nourish people that way. So sit down and think about what are your talents. Are you a
Yeah.
handyman who might be able to help a 90-year-old neighbor who has a light out and can't get up on a step stool to change it? Are you somebody who knits and can, knit some hats and some scarves for our homeless people? Are you somebody who cooks and can volunteer at one of the shelters to provide meals? There are some local chefs here in Denver who are out of work right now because the restaurants have all been closed, and they've gone to homeless shelters and they're volunteering their skills to make a beautiful meal for folks who are really struggling right now. So, sit down for a minute, be quiet for a minute in your own thoughts and think, where are my strengths? What can I do that might be able to help my community? And I think that you'll find areas that you and only you are really good at, and this is the time for you to shine, and for you to really make an impact in people's lives.
I think there's a great opportunity for people to do this, to look around and to be inspired by how people are responding in the face of this crisis.
Yeah.
Maybe to get out and limit some of that fear-inducing media, but instead look around for these kind of things, because it's all over. Talents are a great thing to tap into. It doesn't take any talent to, check on your family, check on people. Verbal messages are great. Somebody was saying bringing meals to the ER. I am not going to stop that.
That was me, Larry.
Many of us have said. Clinton donated hundreds of pizzas in New York.
I know.
How about California?
Yeah.
But anybody can knock on doors of elderly neighbors and say, "Hey, do you need me to go get you some groceries?" So what do? I think you do all of that, and you find a way that you can pitch in.
My sister lives in New York City. She's an international business lawyer, and she is, they have pretty much a stay-at-home order there as well. And she's volunteering to help the elderly and the needy in her community. They, ask around, get on Facebook, do some research online. You're going to find groups that have been set up who are looking for volunteers to maybe go grocery shopping or walk someone's dog for them or whatever. So there are so many ways that people can help out right now.
That's a good way to start our conversation. I like it. I'm due for a grape.
I'm glad I ate before we talked.
This is gonna, for the audio listeners, I'll probably hate that, but so this stuff is gonna go into a audio podcast that'll be all in one place, so it'll be easy to find. I mean, we'll post it on social media and stuff. But so when you were just at work for a few days or 5 days or something, right?
5 days, yeah.
How was it?
Probably the most stressful block of shifts that I've ever done.
Oh, really?
And not necessarily because the volumes have really kicked in, although we were busy, but because we're having to do so much extra work right now, because we're having to be so cautious with anybody who comes in with any type of respiratory symptoms.
You mean isolation and gowning up?
Isolation, yeah, donning and doffing PPE, personal protective equipment.
What does donning and doffing mean? Putting it on and taking it off?
Donning means putting it on, and doffing, donning and doffing, yeah. So putting it on and taking it off.
Where did we get this donning and doffing?
Oh, come on, it's medicine. We have all kinds of silly words just to make us sound smart, which, is ridiculous. But no, so when you are doing that, it's adding, one, to the stress of, are we using up our supplies on folks who maybe didn't need it? But we have to protect ourselves and we have to protect our other patients. It adds, a good 5 minutes to each visit, because we have to do it in a certain way with certain techniques in order to know that we're safe and that our patients are going to be safe. We have had to move patients out of the ER so that we have, I don't know if people understand what a negative pressure room is, or an isolation room. It's something that's set up so that air is being kind of sucked out of the room, and so that when you go in and out, you limit how much of a potential contaminant in the air is going to be going in and out of that room. We only have 2 in the entire hospital, and one of them is not in the emergency department. So we have to walk down to the end of the inpatient hall in order to get to that room, and we're having to put patients down there. So it means me leaving the emergency department, which I almost never do when I'm on shift. I have a thing about, especially when I'm the only doctor in the emergency department, you never know what's going to be coming through the door, in the next 2 seconds.
Yeah.
So I don't like to be out of the ER. But it means, walking all the way down there, walking all the way back, being hot, being sweaty, but knowing if I take off my protective equipment that I'm potentially risking my life. It's a lot of additional stuff. Plus, they're having meetings constantly to come up with plans as to what we're going to do when things start to get really bad. At small hospitals, I think we talked about this last time, but the biggest concern is, we typically transfer patients who are more ill than our facility can manage. But once those hospitals start
getting
filling
full,
up,
that's right.
filling
I didn't
up
think about that.
at these larger cities where we typically transport the patients, then what do we do with those patients who either are, well, and we don't have the capacity or the staff or the supplies. We have one ventilator. What happens if we have 6 patients who need to be intubated and we have no critical care doc? It's just me and some family practice docs who run the clinic. So the enormous weight of the responsibility of these lives that are potentially going to be in my hands. We're used to having lives in our hands. That's our job.
I hadn't thought about that.
And then not only the sick COVID patients, but what happens with that heart attack that comes in? I can't send them to the cardiologist, to the cath lab. What happens with that gunshot wound that comes in who has a sucking chest wound and needs a trauma surgeon? I'm not a trauma surgeon.
I think for those kind of level 1 STEMI trauma activations, I think you'll still be able to send those.
I think that you need to, from what I have seen around the country, there are already hospitals that are shut down and on diversion and are not accepting any new patients whatsoever. So where I work, Bismarck is going to be the closest city, and that's what
do you work it's probably always better to leave.
We're not going to talk about the actual names of the
specific city, but the hospital that you work at, is there inpatient? Can you admit people there?
Maybe
basic stuff, but
2 a month.
Oh, so you don't really even admit
really
much.
Minimal.
Is there an ICU at that
No.
hospital? So it's just a very, very basic hospital and ER.
Yeah. I mean, it's a 4-bed ER, 1 trauma room, which so for example, if I have to intubate a patient, I would normally do it in the trauma room, but they're recommending that it's done in the isolation room, which means that we have to move all of our equipment in there if there's a really sick patient. It means that I don't have as much space to move around and have as many people in there that we normally would. And everybody who's in there, if it is a potential COVID patient, is going to have to be in, gown and gloves and masks and everything. So it really is going to be a challenge. And this is just one of hundreds, thousands of small hospitals in the United States that are dealing with the same questions. So I don't know about you, but the last time I managed an event was in residency. So we have one ventilator, and I have critical care doc friends that you and I both know who have said, just call me if you need me. But this is, I think, what a lot of
you can handle event.
I know that I can. If
you
I
can
have
put some basic settings on there and get respiratory therapists to handle.
But we have one vent. They're working.
Do you have an RT?
No.
You don't have a respiratory therapist?
We do not.
Okay.
Yeah, because normally what we do in the emergency department is we intubate and we say, okay, RT, go ahead and do what you do. For a lot of us, they actually manage.
I intubate. I'm like, hey, put some vent settings on there. Thanks.
Exactly.
And
I'm going to say,
and they're like, what do you want? And I'm like, the usual stuff. They'll say some numbers, and I'm like, yep, sounds good.
Respiratory therapy. Yeah.
Put them on the ARDS protocol. Yeah. Put them on the protocol.
Exactly.
Great.
And for folks who don't know, ARDS is, again, what we're talking about with COVID patients is the acute respiratory distress syndrome, which we see with other infections, but it is kind of the infection that we're seeing in the lungs of these patients. And it's very specific settings that we need for the vent for that. And even now, every day, we're getting new information as to, well, maybe we need to use diuretics on these patients. Maybe the vent settings should, have have a higher, PEEP, which is one of the settings that talks about the pressure that's used for the air that is pushed into the lungs with each breath. So we're still learning so much. There's still so much about this virus. We're finding that sometimes people are coming in with GI complaints, with diarrhea and vomiting and abdominal pain.
Yeah.
Sometimes people are coming in with Bell's palsy and they end up testing positive. Sometimes
Oh
people
my
are coming
gosh,
in
that
with
is so funny you said that because
Guillain-Barré.
I had a patient with a bizarro Bell's palsy that we even did a
Yeah,
spinal tap in, and now that you said that, I'm like,
might have
I've
been
had
COVID.
a bunch of patient the
Might have
abdominal
been COVID.
pain, GI symptoms, nausea, vomiting. I've
Yeah,
definitely thought about. I had a patient that came in, chief complaint was headache,
yeah,
only
headache
headache.
is a
It was a
big one.
little, a little out of the ordinary. Again,
Hmm.
didn't really have a fever and a cough, which is what we
Yeah,
were told initially are the main symptoms of
we're
this
seeing
thing. But
encephalopathy
there's
with it.
so
Yeah,
many different other just non-specific viral symptoms people can have that
and
turns out that's corona. So let's
and
list them.
here's what we're having to do, because we could list every symptom out there and it could be COVID. What we're having to do is we're having to say whoever comes into the emergency department potentially has it. Probably, as the days go on, probably has it. So we need to be cautious with every patient, because I'm talking to people who are anesthesiologists who intubated somebody, again, putting a tube down someone's throat to put them on the ventilator for a regular GI procedure. Somebody who had a narrowing of the esophagus, and that patient came back positive for COVID. Patients who are in traumas, who are in a car accident, and you do a scan head to toe, and you see findings of COVID in their lungs on the CT scan.
I have
So,
heard of all of this
yeah. So
as
we
we're
just have
learning more
to,
about it and
yeah.
finding that it's there's a lot wider
Cardiac
range.
things, cardiac things. People who come in with chest pain, we're seeing a myocarditis with this, so an
Yeah,
inflammation of the muscle of the heart.
yeah.
People are coming back with positive troponins, the protein that we use to look for damage to the heart muscle, and we think that they're having a heart attack. What's actually happening is that the virus has affected their heart.
Yeah.
So we just kind of have to assume that anybody we're seeing right now is potentially positive for COVID.
Now to flip it around on the on the other side is, it's funny because I was talking to a physician friend of mine who got COVID and was test positive, and she was telling me about her symptoms, and she was, oh, I had a headache and fatigue, and she was like, and I think we all have this little paranoia where it's like, she's like, and then I kind of cleared my throat a couple times, and I wondered, like,
Mm-hmm.
do I
Yep.
have it? Is it getting
Mm-hmm.
worse? And then you get some anxiety, and it's like,
I
is
don't
this
know if I've
shortness
had
of breath or is this worsening coronavirus? So
it. Yeah.
um, I think what I would want to reassure people when they're hearing, the truth that there may be a wide range of symptoms is still most people get it,
And get
have
better.
mild symptoms, get through
Yep.
it and get better, kind of
Yeah.
like a flu-like thing.
Yes.
When do you want to come in? When do you get sicker and you want to come in and be evaluated?
So a couple of things. One, any significant shortness of breath, period. And that it could be that you have a pneumonia that's unrelated to COVID. It could be that you're having heart difficulties, but shortness of breath is one of the signs that we're seeing that puts us in a gives us concern that potentially this is COVID. Um, and things related to that. So we look at, are you starting to turn blue around your lips? That means that you're not getting enough oxygen. Um, Chest pain out of the ordinary, especially if it's associated with shortness of breath. Difficulty staying hydrated, because dehydration is also one of the things that we're seeing can cause some dangerous issues with this. So if you have the GI symptoms, meaning the vomiting and the diarrhea and the abdominal pain, and you're not able to keep up with your fluids, then you also need to be seen. Um, so what you don't need to be seen for, sore throat, mild to moderate cough, um, generalized body aches, a little bit of a headache. Those are the things that kind of flu-like symptoms those are the things that, even with the flu, there's not a whole heck of a lot that we can do about that. It's really just rest, fluids, some Tylenol,
Mm-hmm.
and time.
Mm-hmm.
And it's the same thing with COVID. A lot of people just have those symptoms, or even have less than that, which is why this virus is so dangerous, because people may think, oh, maybe it's just allergies. I got a little runny nose and I got a little tickle in my throat, got a little cough, but actually you're contagious and you're potentially passing it on to people who are going to have a much more serious course with the illness.
I want to see what you think about this. I read this thing today where in San Francisco they were looking at the genes, the genome of
Yeah.
these COVID positive patients, and they were able to track kind of where it had come from.
Yep.
And over 50% of it came from outside of the community, i.e., Washington,
Mm-hmm.
China, that
Yeah.
kind of thing. But this is what, and so they thought, well, maybe we are doing a good job in California with social distancing. Maybe this is making a difference. Um, but 20 to 30% was healthcare workers who were getting exposed
Yeah.
at the office and bringing it home,
Yeah.
to their families, and that
Yeah.
ended up being a source of infection in the
Which
community.
is which is why our lack of PPE is so worrisome to all of us, because I'm in a situation where I am divorced. I don't have a human at home to come home to and potentially infect, but that's not the case with most of my colleagues. So the con, we're seeing large percentages of healthcare workers who are becoming infected, who are worried about going home to their families. And I think we talked about this before, but people who are either staying in hotels, um, telling their families, I'm not going to see you for a few months, because they're anticipating that that's how long they're going to be on the front lines of this, or longer. People who maybe are going home, but they're always in masks around their family and they don't touch. It's hard if you're, I can only imagine, because I don't have kids. It's hard enough for me, who
Yeah,
is somebody who likes to hug people. I haven't had a hug in 2 weeks, 3 weeks. I mean, that's tough.
yeah,
But let alone you have a little kid at home that you want to hold as they fall asleep at night, or a spouse that you want
yeah.
to give a reassuring hug to, or a kiss on the, this is incredibly hard on our frontline healthcare workers. And I think people are starting to realize the sacrifice that um, that these folks are making, but it's not going to get better for a while. And these folks and their families are going to have to live with that and have to
What
find
kind
a
of
way
a
to do
timeline
it.
do you have in your head for how long we're going to be like this? I feel like it's going to be a couple months.
I think at least, yeah. I think that the peak. So what we talk about, if folks don't know, is that there's the initial kind of silent spread, where folks maybe are getting a little bit sick, but passing it on because they don't know that they have it and they're not social isolating. And then all of those people take up to 14 days to become symptomatic typically. And then
There's
all of
this
a sudden,
delay.
there's a delay.
Oh, nothing's
And then,
happening, and then
and then boom.
yeah,
And then what's happened is that while those people, say day one, someone infected somebody, and then that person infected somebody on day 5, and then that person infected somebody on day 10. So all of those people are out there waiting to kind of start to get sick.
yeah.
So we have a timeline where it's kind of nothing, and then the line starts to go up. And right now we're like this. That's concerning. If you look at some of the graphs of where we're at, I mean, today we've already had almost 16,000 new cases in the US. We're at 2,000 deaths in the US. We're at 650,000 worldwide cases. And again, we haven't done a great job testing.
Yeah, I mean, it's hard for me to know what these numbers mean when we weren't testing from the beginning. We really weren't aware. Part
Yeah.
of the spike is, well, now we're testing, but then it
Yeah.
also, I think it does still attest to increased number of cases. So part of me is not sure what to make of it.
Well, and I think, it's hard for us to also trust some of the numbers coming out of some of the other countries. There are
Yeah,
a lot of, there's a lot of skepticism over the numbers from China. We know that they weren't terribly honest at the outset when this first started, and they tried to suppress information.
yeah,
So we don't know how many actual cases they had or still have, and how many actual deaths that they are counting as COVID deaths. We know that in places like Spain and Italy, where the death counts are enormous, that they're also not counting people who are home and died, never came in.
Mm.
There are a lot of questions as to the actual numbers here. What we need in the United States, we need more testing. We need widespread testing. Everybody needs to get tested. We're not going to get our heads around this and understand how much the population is affected and infected. And we're not going to be able to say, okay, you have it, you need to stay at home for 14 to 21 days to not infect anybody else if we're not testing. The
It's
other thing we desperately need.
I have to, and I know where you're going with this, but I have to agree and emphasize. I remember even a week or two ago, the party line came out where it's like, oh no, everybody doesn't need to get tested. This is what we're doing. Stay at home if you're fine and whatever. And then I have patients coming to me and they're like, well, I don't know if I can go see my old mother.
That,
I don't feel safe going back to work on the floor in the
exactly.
hospital. I don't know, even though they weren't super sick, there was I work in a prison. I don't want to be contagious and bring it back there. These people, these patients weren't listening to the big rule and they were like, no, I
Mhm.
think I need a test. And I would sit there in the beginning and I would argue with them. I'd be like, no, you don't need a test. And then I would listen and I was like,
Yeah, you
no, this
probably
is a
do.
reasonable thing to get
Yeah,
tested for.
yeah.
You're right. And
You're right, but we don't have the ability to
this
do
is
it. That's the
frustrating
problem.
that there aren't enough tests that can get
Yes.
turned around quick to answer these questions. And so
Yeah.
I'm with you, like as a doctor on the ground, I'm like, I don't think the thing that we're doing now, testing right. I don't agree with it. I don't think
Yeah.
that's the best way to go about it.
And the numbers from, if you talk to the experts from, the epidemiological side of things, odds are we have 10 to 20 times the number of infected people out there as we have to the number that we've actually tested. So you can multiply that 15,000 um, that, or the 15,000 new cases that we had today, and that's actually 150,000 or 300,000 out there if we were testing.
I think another way to like estimate how many are actually sick population wise is
Hmm.
we will track the deaths.
Yeah.
And so you
You
take
look
the
at the
deaths
critically ill,
and you say
and we
however many,
know
and then you
5%.
and then you go backwards, but
Yeah.
there's going to be the lag, and so
Yes.
you're only going to know the numbers for 2 weeks ago. You know what I mean?
So a couple of things. So with regard to the lag, and I want to go back to testing, but with regard to the lag, it's also important for people to know right now they're seeing that spike because we're testing and because more people have gotten sick. But also, people look at that and they say, well, maybe social distancing isn't helping. And that is not the case.
Totally.
Social distancing has a lag. What we're doing now is to prevent the cases that are going to happen 2, 3, 4 weeks down the road. It's not an instantaneous, okay, everybody stayed home. And so now the cases should go down. What we're seeing now are the people who got sick 2, 3, 4 weeks ago,
Yeah.
who we're now seeing in the hospitals, who we're now testing positive. So please be patient. Please know that everybody is important on this. Every single person, if you're sneaking out to see your boyfriend and then you come back to your family, you've now exposed both your boyfriend and everybody he knows and is in contact with to people that you've been in contact with, and vice versa. So you're bringing back whatever bugs your boyfriend or anybody he's been in touch with has to your family.
No, I would totally emphasize like now is the time to keep doing your part,
Exactly.
especially as we see numbers go up. Just know that it makes a difference, and not
It's a
not throwing the towel in, but
it's a labor of
matters.
love. It's a labor of love, and it's a sacrifice that we are all making to try to prevent those people who, if they caught it, uh, they will die. Now, going back to testing,
Wouldn't it be nice if there was a
if we
test to demonstrate
and
immunity?
exactly so, and that they're working on it. But what we need is a widespread test so that you can know, have you been exposed? Because again, I may have had it 3 weeks ago when I was sick, and I may have had it 6 weeks ago when I was sick. I've been sick twice in the last 6 weeks. And I don't know, was that just a really bad cold bug that I picked up? Was that the flu? Or was that potentially COVID? If it was COVID and I could prove it, then I'm not going to be scared every time I walk into work thinking, am I still waiting to be infected? And am I going to be one of the people because of my asthma, et cetera, that I'm going to potentially die from this? The peace of mind that I can have going into work, one, knowing that I'm not going to infect anybody, and two, knowing that I'm not going to be infected and that I can safely work on the front lines. That is vital information for us to have. Also, because eventually, unless we have a vaccine soon, which again, we're looking at 12 to 14 months before that can happen.
Yeah, it's not happening.
Then at some point, 100% of the population will get this. There's just no way around it. We're looking at 50 to 70.
I've heard 50 to 70, but
50 to 70%
everybody's going to get it.
50 to 70% this year is the estimate of people who will get it.
Everybody's going to get this? I had that I hadn't heard.
I
thought it would die out as immunity rises in the population and people become immune. Eventually, it won't be able to continue circulating, and the virus will die out. Like every year, everybody doesn't get the flu.
Most people do get the flu, and they're exposed to the flu, but they have antibodies from it, or they have an immunity to it.
I don't think every year. I think
not every year. No. I'm saying from a lifetime of living, you are eventually going to be either exposed to or get the flu.
Yeah, over the time.
Exactly. What I'm saying is over time, people will, if we're unable to corral this thing, which at this point it is everywhere in the world, from what we've seen, it is widespread.
Then the annual incidence of the flu is like 9%, 10%.
But the flu, this is different. It's
10
more
contagious,
more
but I'm just arguing. I'm making the argument that I would not say 100%. I don't think everybody is eventually necessarily going to get this.
I guess we'll have to see. But the way that I look at it, sure. The way that I look at it is that this is a novel virus that humans do not have immunity to. Those people who do get it will eventually become immune, we hope. We're not 100% sure on that, but we hope.
Yeah,
and Dr. Fauci...
that doesn't make sense to me either.
What?
That you get a virus, and like anything else, we can talk about this and talking about the test.
Mm-hmm.
The virus
they think
comes
it's
in.
more like varicella, in the sense that if you get chickenpox once, the odds of you getting it again are pretty slim.
Yeah.
So they think it's more like that than it is like the flu, that mutates so quickly that just because you had the flu last year doesn't mean that you're not going to get the flu this year.
So in either case, you get infected with a specific virus and your body develops antibodies.
Exactly.
Immunoglobulins, Ig. This matters for the testing. And the immediate one is immunoglobulin, IgM, antibody M. And so that one rises, and it takes over and kind of crushes the virus, clears the virus from your system. If you get exposed, let's say you do or did have the virus, and for the next 2 months, we both get exposed. Once our antibodies are high, we don't get sick again. Just they flick it off. They fight it off because that's what our immune system does. So this is where you and I are talking about this. Gosh, if we had a test that could demonstrate that we had those antibodies up to this specific coronavirus, that would be IgM in the short term, and then in the long term, antibody IgG. Right. And so if there was a test for both of those, I would pay out of my pocket for that thing.
Exactly. And not just healthcare workers, but for everybody. So imagine if you had the ability to test a teacher before they went back to school and the kids before they went back to school. Then you can say, okay, this teacher can go back into the workforce and she's not a risk to others and she's not at risk for getting this. Same thing for restaurant workers. Same thing for, people who work at Walmart or whatever. We know that we can safely put these people back out into the world and they don't pose a risk and they're not at risk. So this is something that hopefully we will have available widely. But I think some of the first people who need to get it are folks like you and I, because not only are we at significant risk, but we pose a significant risk to our patients. Imagine if I did have it and I didn't know it, and I saw a sick 70-year-old woman with heart disease and with sick lungs from COPD/emphysema.
No,
And
I
I
know
gave it to
exactly
her.
what you're
My
saying.
God. I mean, the guilt that I would have, we're healers. We're the ones who are supposed to be there helping people. And to think that I potentially could have, there was a nurse in Italy who committed suicide this week. I don't know if you saw that.
No.
She committed suicide because she tested COVID positive and she did not want to pass it on to anyone, and she was concerned that she already had. I
Jeez.
mean, this is who, and we could avoid that portion of this, the fear of us getting people sick
The,
or
the,
passing it on to our loved
I mean,
ones if
it's
we had this.
so. I think it's really funny because before even talking to you and reading the Facebook things, I'm just like thinking through this on my own on the front line and in the ER, and I'm like, gosh, we should be testing more people to know if they're positive in the moment. And then I'm like, this is what we really need. And I think it's so clear and obvious to you and to me, and most of us doctors are so united on testing
Mm-hmm.
and more protective equipment. It's
Mm-hmm.
we don't, we've got the AMA, right? But that
Well,
is
and here's
so. But then you look around and it's not happening. And then
not only
there's
that, Larry,
and then
people are
there's so then you got to start asking questions that are very threatening to the government, that are threatening to systems,
yeah.
to why don't we have this stuff? And part of the answer is because it costs money, and who's going to pay? And in our system, right, the government doesn't want to cut that check. Trump doesn't want to write a check for all this, even though we did a $2 trillion, you know, politics enters that. And then we have a system. There's money.
There's another side of that which is starting to come out. We are seeing, I now know of 2 physicians who were fired because they stood up to say that they needed personal protective equipment for themselves and for their staff. 2 physicians.
And you see these articles coming out of New York on CNN, and they'll say, well, a doctor agreed to talk to us as long as they had anonymity because they were
Well,
worried they were going to be
because they're
fired.
worried about, yep. Not only that, we're also seeing corporate medical groups slashing physician salaries 20 and 30%.
I saw that. That's insane. In the middle
At a
of this
time like
thing.
this, they're laying off people or they're telling them that they need to stay home and they're taking away their hours because right now it's slow, and they
And it's going to
anticipate that
get
they're going to need them
crazy.
in the surge.
That's so
So
insane.
this is not
But
how you
there was,
treat your
which group was
frontline
it? I saw
people.
there was a huge group. Was it,
Yeah,
I
I'm not
forget
going to
which one
name
it
names,
was. Oh,
but
right. Well,
it is, not only that, they're asking physicians, just physicians, not other healthcare workers, to come and volunteer for free in places like New York and some of the other hard hit places, whereas they're giving additional money to folks who are not physicians. And I know what people look at us and they think, oh, you're a physician, you must be incredibly wealthy. They're not seeing the $306,000 of student loans that I came out with, and the mortgage, and the fact that I live paycheck to paycheck.
or it's like, it's
Anyway,
just, that's the
you
system.
can't, physicians don't have a union yet. We don't have anyone to protect us. And when admin is coming and literally ripping masks off the faces of physicians and saying, you can't wear that because you're scaring the patients, and they're worried more about looks than they are about the safety of either their physicians or their patients. It's a real problem. We're, in a sense, being asked to just throw ourselves on our swords and go to the front lines with no protection whatsoever. And we're seeing people fall. We lost another physician in Florida this week. We lost 2 nurses this week. And this is just the beginning. We're going to see. They've lost 43 physicians in Italy so far. And this is going to continue for, through the surge. And the surge is going to hit at different times across the country and across the world.
I think it's pretty clear what we want and what, enough protective equipment so that everybody in medicine stays appropriately safe.
That's not too much of an ask.
I don't think it's too much either.
Give me a mask. Thankfully my hospital We have masks, but we have to be incredibly careful with them. We're given one a day, and we have to have one face shield a day.
Now, I don't feel like at the places that I do work that
Mm-hmm.
I've felt any shortage
Mm-hmm.
now.
We don't
I
have a
don't I
shortage
haven't
yet.
I haven't felt that, but
Yeah,
I have heard from so many doctors
we
all
are.
over the country that this is a real issue,
Yeah.
and it and just
New
and
Orleans is one place. New York is another. You're seeing nurses wearing plastic garbage bags instead of gowns. One of those nurses who um, died this week was one of the folks who had to wear a plastic black garbage bag instead of a protective gown at work. So our folks are being exposed, and he was young. He was 48, and he died. We're seeing a lot more young,
wow.
healthy people without other illnesses who are intubated and in
Right.
ICU and dying. We had a 17-year-old in California that died. We've had a 26-year-old athlete who had no other medical
I
issue.
want to talk about that for a minute and
Yeah,
get your take on this. Um, because I'm hearing from the ground also, and I've seen a couple cases of younger people with respiratory failure, low oxygen levels, and so forth. And when I look at these numbers, let's just take under 40, for example, 0.2% mortality or death rate, meaning 99.8% survival rate. So
hmm
out of a
in that
thousand,
group. Yeah,
yeah, in that group,
yeah.
out of a thousand, that means there'll be two that die.
hmm
And so when I hear doctors saying, "Oh man, like I saw a couple of young people get in," which we don't normally see. It's very
Yeah,
rare. I mean, I have seen young, maybe they have some medical issues, but 20s and 30s. We had somebody at a hospital I work at that was intubated with respiratory failure from influenza 2 or 3
yeah.
months ago. It happens.
Oh, it
It's
happens.
not very common. I mean,
Tragic, but it
I haven't
happens. Yeah,
seen 10 of those in 10 years. I don't see a
yeah.
lot of that. But so you start seeing more and it's like, "Oh, this is different." And then you get this fear like, "Oh my God, is this coming for me?" And what I want to separate, I want to get your opinion on this is when I look back and I look at the numbers, okay, 99.8% means 2 out of 1,000 are going to get in trouble. And when we see that, we're definitely going to take note of it. It's going to be newsworthy. It's going to get into the news. It isn't the case that this is going to wipe everybody out.
No.
Most people should feel safe and not like 99.8 means
Yes.
you're fine, right? That's just not a scary roulette 2 in 1,000 kind of thing. But this is how you make sense of the media. It is newsworthy. We are going to see it. Doesn't mean that thing's going to come and kill everybody, but it is also true that some young people are affected.
Here's what I would say to that. One, it's shocking when we lose somebody in that age group who is otherwise healthy. Um, I think what's happening here is that things are very um, condensed right now. So what we're seeing is, and we're again just kind of on the start of this, but we're seeing this surge in cases, which is the whole reason why we were trying to again flatten that curve so that we don't have all of these sick patients all at once.
Right.
Because what happens when you have a surge like that is it overwhelms the medical system, and then people who otherwise normally wouldn't die will die simply because of lack of resources and lack of staff, lack of hospital beds, lack of ventilators. I think what's happening when it comes to these younger patients is that yes, that does happen every year. Back when H1N1 hit, it in particular was bad for younger, healthier people. And we think that's because their immune systems were stronger and they had this overwhelming immune response when they did get sick that caused them to go again into ARDS, into this acute respiratory distress syndrome. I think what's happening with this particular virus is it's all happening at once. Within
Yeah.
a few short weeks and months, we're seeing this. So those numbers are very compacted all together. And yes, 2 out of 1,000 is not a huge number, but you multiply that by the entire population of the United States, in a very short time, we're going to see all these sick people, and we're going to see a lot of young, healthy people, simply because instead of being spread out over the year, we're seeing them all at once within a few weeks or a few months' time. So I think that that causes the focus to be on that more, because there are going to be more cases all at once rather than spread out.
Yeah.
And still 2 in 1,000, still too many.
Yeah.
That's still too many. And again, we don't want
It's
anyone to
significant.
die.
It's still significant.
Yeah. But if we're seeing them all at once within a few weeks' time, then we also worry that those patients who might have otherwise made it because they have the ability to bounce back, because they are young and healthy, due to lack of resources, lack of staff, and all of the things we talked about, that they may not. So,
let me ask you a different question. So, New York is going through this right now, and I wonder, I mean, I know people there. My heart goes out to everybody in New
my
York.
sister's there, yeah.
Why do you think they've gone through it first? Do you think this is a population density thing? And
Partly.
do you think that the same thing is going to happen elsewhere? Are you hopeful that, I'm kind of hopeful that maybe we're more spread out, maybe social distancing, we've had a little more time. I'm looking at this, I looked the other day or so ago, it was like New York State, 30,000 cases, state of California, 3,000 cases. Yeah. City of San Francisco, 253 cases. And I was like, oh, that's what I'm seeing too, is not very many yet. I mean, preparing and anticipating, like, I think more is coming. How bad it's going to be, I don't know.
Yeah, I think there are a couple of things there. One, yes, the fact that people are packed very tightly in New York contributes to how quickly and easily this has spread there. Mm-hmm. But also, New York, you have so many international visitors to New York who potentially brought this with them.
San Francisco's got China.
Yes, San Francisco as well.
One of the biggest China towns.
I think that it has more to do with how tightly packed people are in New York and how quickly it spread unnoticed. And now we're seeing the effects of that. Yeah. So,
how bad do you think it's going to get for the rest of us?
For the rest of us, I think it's going to get pretty bad. I think it's going to vary city to city. I don't know if you saw Governor Cuomo's talk today, but in New York, they are converting, in each borough, they're in the process of converting an area to be essentially a mobile hospital / treatment center for people. Wow. They're anticipating that they need 130,000 additional hospital beds in New York. They are estimating, as you may have heard, that they're going to need 30 to 40,000 ventilators. There was a report yesterday about a patient sitting in an ER waiting room who died waiting to be seen from COVID because they're simply overwhelmed. You may have seen the story about the physician who kind of gave an inside look at risk to herself and to her job.
I saw that one in New York, yeah.
Yeah, refrigerated trucks to hold the bodies. So New York has been hit hard and will continue to be hit hard, and they're anticipating that they're nowhere near the surge. They thought that Los Angeles and San Francisco were about a week behind them.
Yeah.
But it's hard to know. It's hard to know because, again, social distancing did go into place. Your governor took matters into his own hands early and said, this is what we're doing. I don't care what anybody else says. I am going to do whatever I have to do to protect my people. I wish more people had done that. We were a bit slow here in Colorado. Louisiana, God help them. Again, I hate being right, but I told a friend who is from Louisiana over a month ago, I said, you guys are going to be hit incredibly hard because of Mardi Gras. Had over 1 million people who came to that city and then dispersed.
Oh, that's right.
And they are overwhelmed. We're getting stories from physicians and nurses there, and it's bad. So I think that certain cities are going to be hit harder. I think the earlier that we got the social distancing and the stay-at-home orders in place, those places are going to be hit less hard. Um,
All right,
yeah.
Jenab, make me feel better. I'm
Okay.
getting stressed out, and
I'm sorry, Larry.
we got to keep this a little bit. We got to get through it. How are we going to get through it in the
Yeah.
midst of this
Well, we are
reality?
going to get through it. I think a couple of things. I think, we both have a colleague that again tested positive for COVID, and she had kind of a rough flu-like illness for a little bit, and she's doing great. And she is now back at work and knows that she's not contagious and knows that she's not going to get infected, and she can work more freely now because of that. And I'm
I was
hoping.
talking to her, and I was like, "You know what this is like? You're like bulletproof now." And do you
I
remember?
know that's
Like, did you see that Wonder Woman scene? Where Gal Gadot just jumps up on the battlefield, and there's all these bullets, and she's just like, "Bing, bing." She's like, "I've never seen Wonder Woman," and I'm like, "Well, you need to
Oh,
watch it
come
because
on.
that's what you are now."
Well, when all this is over, I'm going to take her out to dinner, and we're going to watch Wonder Woman together. Um, so I think that there are going to be a lot of us who are just fine, who are on the front lines, and who are going to be able to again, especially once we get this antibody test, be able to get back to work and know that we're going to be okay. I think that's going to alleviate a lot of the overwhelming sense of dread that a lot of us have going into work every day. Um, I am incredibly proud of all of the retired physicians and nurses and
Mm-hmm.
respiratory therapists who have heeded the call and who have come out of retirement to work to help out. I am overwhelmed with the support that I've gotten from anybody who finds out that I work in medicine, how grateful they are, how thankful they are, how they stop and take the time, whether it's online or in person, to say you guys are doing heroic work and we thank you and we know that you are on the front lines and you're what's holding back the badness for us and you're
Yeah,
doing
it
it for us
helps.
and
It
we're
does.
grateful
It
and that
really does
feels really
help.
good.
Yeah.
Yeah, I don't know if you've seen this. There's a group of celebrities who have been filming um, thank yous to particularly ER physicians. This includes people like um, famous comedians and people from ER, the show, and people from um, like Rob Lowe, and like all of these people who, there's a term BAFERD or Bafford, which means badass effing ER doc
Mm.
for younger ears. But they've caught on to that term, and they've been using it, and they've passed it on to all their friends, and so now we have dozens of really cool emails, videos from these
Fun.
celebrities, and things like that. Yeah, we're doing good work, and it's okay to hear that and to take that in and to understand it and to take it to heart.
Yeah.
We usually are silent in the background, just head down doing our job, not asking for thanks, not asking for praise. But in a time like this, when we're literally putting our lives on the lines and we're exhausted all the time and we're stressed out, that can really lift you up and make you feel good. So I
It
thank all the people who have taken the time to thank us.
it does help to sustain and support and keep you going.
Food for the soul,
It's been a great chat, Jane.
as always.
You look good. Stay healthy. Get
You
some
too.
rest. Get into that garden.
I will. I'm leaving in just a few minutes to go get my garden on.
Um, can people? Do you want people to find you somewhere on social media, or do you have any
Mm,
final calls to action before we close this out?
um, I'm on Facebook and Instagram and Twitter. It's just my name,
What's your name? Jane
Jane
Jenab.
Jenab, Jenab. I've made more of my posts public lately because I am trying to help answer questions. Um, I usually try to keep to myself though. Um,
Well, that was
Dr.
that
Jane's,
was the only thing that's been a lie today. Everything else has
Dr.
been true.
Oh, please. Dr. Jane's General Store is the one place where um, I post all my gardening stuff. So,
Oh, fun.
um, other than that, what was the other question?
That's it.
Call to action.
Oh yeah, call to action.
Um, yeah, I think what we were talking about earlier, just find out where you can do the most good right now. And it's going to be individual. It's going to depend on your situation. It's going to depend on your community. But people need you. And right now, a lot of folks, not everybody, but a lot of folks have the time at home to do that. One of the best things that I saw was that the shelters for animals in New York City have run out of dogs to be fostered because
Oh,
so many
wow.
people have stepped
Oh,
up and
because
have
they've been
taken
at
in
home.
because
Because
they're
they've
at home
made
right
it
now.
dogs.
And
That's
animals can be amazingly comforting in these times. To have someone, maybe you're like me and you don't have a human family at home, but I've got my dog and my cats and my chickens, and that means something.
chickens.
You got someone to interact with and to take care of and to
Yeah.
fall asleep at night with them, sitting by your head or whatever. So there are, whether it's humans that you're helping or animals or the environment, there are ways that you can make an impact right now, and it feels really good to do that and know that you're helping in this tough time.
Absolutely. Thank you for listening. This is Dr. Larry Burchett. This has been Corona Daily Q&A with Dr. Larry Burchett. You can find that everywhere podcasts are available, in addition to my Instagram, Dr. Larry Burchett, YouTube channel, Facebook, etc. We will see you next time.